This video will talk about what is the dialysis and the types of the dialysis. But first, we need to define what are the kidneys. The kidneys are two bean-shaped organs that lie just below your rib cage on each side of your spine. They remove waste and fluid from your body, level out your blood pressure, and keep your bones strong. They also ensure that you have the right amount of minerals like potassium and sodium in your blood. Finally, they make the hormone that causes your body to create red blood cells. What is dialysis? It is a treatment that takes over your kidney if those organs stop doing their job. There are two types of dialysis. Hemodialysis. Your blood is put through a filter outside your body, cleaned, and then returned to you. In hemodialysis, an artificial kidney, or what we call as the hemodialyzer, is used to remove waste and extra chemicals and fluid from your blood. To get your blood into the artificial kidney, the doctor needs to make an access or entrance into your blood vessels. This is done by minor surgery to your arm or leg. This is done either at a dialysis facility or at home. Number 2. Peritoneal dialysis. Your blood is cleaned inside your body. A special fluid is put into your abdomen to absorb waste from the blood that passes through small vessels in your abdominal cavity. The fluid is then drained away. This is done either at a dialysis facility or at home. How do I prepare for hemodialysis? Prior to undergoing hemodialysis, it is needed first to have a minor surgical procedure to prepare for ongoing treatment, or what we call as the vascular access surgery, to allow for easy access to the bloodstream that provides a mechanism for blood to be safely removed from circulation, filtered, and then returned to the body. The preparation ideally starts several weeks to months before dialysis is necessary. However, if the need for dialysis is urgent, there are options for access which can be used immediately. And these are the three types of vascular access. Number 1, an arteriovenous fistula. It is made by joining together an artery and vein to make a bigger high-flow blood vessel. Number 2, an arteriovenous graft. So this is where a soft plastic tube is placed between an artery and a vein, creating an artificial high-flow blood vessel. Lastly, a catheter. If kidney dialysis has progressed quickly or there is no vascular access placed before dialysis, a venous catheter is needed as a temporary access. How long do hemodialysis treatments last? The time needed for your dialysis depends on number 1, how well your kidneys work, number 2, how much fluid weight you gain between treatments, and number 3, how much waste you have in your body. Usually, each hemodialysis treatments last about 3 to 4 hours and is done 3 times per week. How to prepare for peritoneal dialysis? Before peritoneal dialysis can begin, a catheter must be inserted in the abdomen, which allows for transfer of fluid into and out of the abdominal cavity. What is the most common problem that happens in people who do peritoneal dialysis? An infection in your belly called peritonitis is the most common problem that happens in people who do peritoneal dialysis. Here are the ways to keep catheter clean to prevent infections. Number 1, store your supplies in a cool, clean, and dry place. Number 2, inspect each bag of solution for signs of contamination, such as cloudiness, before you use it. Number 3, find a clean, dry, well-lit space to perform your exchanges. Number 4, wash your hands every time you need to handle your catheter. Number 5, clean your skin where your catheter enters your body every day as instructed by your healthcare team. And lastly, wear a surgical mask when performing exchanges.